Hello. Today we'd like to talk about cutting and pivoting sports in young athletes and with a particular focus on injury prevention strategies. My name is Kurt Vandenberg. I'm at Children's Hospital Colorado in Denver.
And I'm Matt Ellington. I'm at Central Texas Pediatric Orthopedics in Austin, Texas. So we're really going to try to talk mainly about preventing this injury right here. So you see this girl playing volleyball comes up and then comes down, landing on that right leg, and this led to an ACL injury.
And before we start, just a little background on where we're at in the US right now in terms of youth sports participation. The Aspen Institute has the best data that I'm aware of in this space using survey data from the Sports and Fitness Industry Association. This is surveying thousands of households across the US. And when we look at this age group, the kind of 6 to 17-year-old age group, there's actually a relative decline in the number of kids participating in team sports. And so if we look from 2019 to 2022, that accounts for about 1.2 million fewer young athletes participating in sports. And so the question becomes, well, why are we seeing an increasing rate of certain injuries, ACL in particular? And really the only explanation is that the kids who are still involved are probably doing so at a higher level on a more frequent basis, maybe even year round. And when we break it down by gender, we're seeing right now about a 40% overall participation in males and close to 35% in females. So boys are going down a little bit, girls are going up a little bit in participation. And breaking it down by sport, there's certain sports that seem to be somewhat declining overall in participation. We can see some of the numbers here. Gymnastics, swimming in particular, point those out as ones that have had reductions in participation rates. Golf and tennis, at least in this graph, have the highest increase in participation.
So when you look at how many of these ACL injuries do we have found that over the last 20 years that ACL injuries in these populations have doubled. We have up to 250,000 injuries per year with a cost of about 13,000 per surgery. A quarter of these injuries are occurring in kids less than 18. The relative risk in girls is about 2 to 8 times that of boys. A multi-sport female athlete has about a 10% risk of ACL injury throughout her high school career. Injuries most common in girls soccer and boys football. And then soccer, basketball, lacrosse, and football are really the sports at the highest risk of injury.
And we're focused on ACL tear today because this is really one of the more devastating injuries we see in young athletes. Just given the length of recovery and rehab involved, this gives us a visual of what that injury is, what the surgery is. We can see here just a graphic of a knee, and the surgery involves placing a new graft in the joint to recreate or reconstruct the ACL. And this is a big deal that go through this injury and this recovery, not just the surgery itself, but the recovery. We can see here this overall time frame for recovery. We tell patients this is a 9 to 12 month recovery, in some cases more. And it starts right away with early rehab for range of motion and strengthening. And over the course of this several month, up to 1 year period, it's progressive strengthening. And as we get further along, more sport specific training and exercises with, at the very end, some specific testing to make sure these athletes are as ready to go as possible with the lowest likelihood for re-injury as possible. And when we try to understand the important factors around ACL injury, one of the studies that I found really helpful for this was this 2018 International Olympic Committee consensus statement. So this was 21 experts around the world, primarily orthopedic surgeons and physical therapists, focusing on the aspects of these injuries in young athletes that are most important. We wanted to focus on the injury prevention aspect. And what this committee sort of concluded was that there are modifiable risk factors to reduce or prevent the likelihood for an ACL injury. And what this comes down to is improving what we call biomechanical movement patterns. So this is a large focus on things like strength, plyometrics, sport-specific agility training. And it's really important that both the coach and the athlete get educated on this. And this largely centers around concepts with cutting and landing techniques. An example of that would be when you jump and land, you're landing in a flex knee position. And these are easy to implement. There's no specialized equipment. It can be part of the team's regular training, ideally 2 to 3 days a week. Easy to implement, low cost, but the hard part is you have to do it. So success depends on adherence and consistency. So our main hope today is that we just communicate that there are well-known prevention strategies for this, but getting the word out to the coaches and the athletes and getting them to do it on a frequent basis, that's the challenge.
So looking a little bit more at these different injury prevention programs, so these have really been very well studied over the past 30 years. Like Kurt said, these really include strengthening, plyometric, and agility-based drills. There's 3 main different programs, the 11 Plus, which is formerly called the FIFA 11, the Prevent Injury and Enhancement Performance Program, and then the Knee Control Program. So we know that these work. These work actually very well. We have studies showing that they really can reduce the rate of specifically ACL injuries in female soccer players. One of the biggest things that we know, though, is that the more compliant you are with the programs, the less injury risk that we have. Parental awareness is also key. So this was a study that we actually performed throughout the US. We looked at a total of 244 parents. The most notable finding from this study is less than 20% of these parents were even aware that injury prevention programs existed. And of those, only 6% had participated in one. So really the most common reported barrier was lack of awareness. And we're really trying here to really provide awareness that these programs exist and that they work very well. So some things that you can do for implementation. So try to use this more as a warm-up. So this is a great warm-up, a great dynamic warm-up for these athletes. Also really have the athletes kind of buy in, right? So these can potentially improve their entire athletic performance. So it's not just something to do, right? This is making them a better athlete. Another option is to try to utilize role models in the community, whether it's professional athletes, even high-level high school athletes and college athletes as well. So what are our barriers to these implementation process? So motivation, compliance, time requirements. Kurt touched on cost really not being that big of a barrier. Skill requirements, but the biggest thing I think is coaches buy-in. So we've really got to make sure that we implement these for the betterment of the players' health and overall sports performance. So in conclusion, we really do know that these injury prevention programs work very well to decrease these lower extremity injuries in cutting and pivoting sports. It is crucial, however, to have buy-in from parents, coaches, and players, because we know the number of ACL injuries is only going up and the number of kids playing sports is going up as well. So we really have to do all that we can to try to decrease these injuries in kids. I always tell, kids that have not had an ACL tear that the best way to treat an ACL is to prevent it. Thank you.